with tiny tabs, and that helped the digestion, but the cystitis was still there. She also mentioned the cystitis was usually triggered by stress and sex as well. So she was getting to the case where it was coming up all the time, and she was avoiding having sex as a result, and that was putting more stress on her relationship. So you've got a real catch-22 here. So now what she finds is when the cystitis starts, or what she was finding then, was that she was drinking lots of water and taking very high doses of vitamin C, and that would last out the cystitis, but it would upset her stomach again. She's also a person who can get easily anxious and stressed, which fits in with what we've been talking about. And the specialist couldn't find anything wrong, actually. So her urine was clear. So those antibiotics actually seem to be quite unnecessary on that level too. So it was a case of inflammation. And she noted that her bladder tended to stay tender for a while after the cystitis. She was also dairy intolerant. She'd had a low-level funny tummy since her 20s until she stopped milk. She still has more fermented forms of dairy, but milk not. And that was triggered again with antibiotics. She'd also been weak-free for years and had just found out her father was celiac. Alcohol gives her night sweats, bloating and cramps. So she's quite sensitive to these triggers, things that are prone to cause a little bit of inflammation. If there's already inflammation there, it's going to trigger a lot of inflammation, and that's what she was finding. Her stools were generally quite soft, with phases of quite loose and generally prone to bloating and cramps. So again, that sensitivity there, because underlying picture is of inflammation. So anything that's going to add to that, she's going to really feel. And cystitis and colds are sometimes accompanied by